Okay, I'm Congressman Tom Suozzi. I represent the 3rd Congressional District, which represents Nassau County, a little bit of Suffolk, and a little bit of Northeast Queens. I'm joined here today by my colleague, Congresswoman Gillen, who represents the rest of Nassau County. We're here today with some very important leaders from our community that are going to be very, very affected by the proposed budget, what the President called the big, beautiful bill that was passed through the House in the middle of the night last week. It got very little attention, quite frankly, because people were distracted by other topics that the President brought to our attention, like the jet that came from Qatar, things like that. And it's going to be debated next week in the Senate. And we're really here to point out our concerns about this bill. It really was a party line vote, unfortunately. You know, I'm always talking about bipartisanship and the need to work together. And this bill passed by one vote. Again, after middle of the night debates where people literally fell asleep and didn't make it to the vote because it was going through the middle of the night for 24 hours at a time. And I've got 3 big concerns about this bill, and then I'm going to hand it off to Laura, and then I'm going to introduce the folks that are up here to tell us about how this specifically affects the agencies or the organizations that they work with and the real people that it affects, real lives. This is not just numbers. This is not just politics. This is not just things you read about. This is real life impacts on people. So my 3 big concerns are, number 1, is there's massive cuts to Medicaid and to what's called SNAP, which is more or less food stamps, food assistance. And some of the most vulnerable people in our country, and certainly here on Long Island, are going to be affected by this. And it's going to affect the economy. It's going to affect the way people's lives are conducted here on Long Island. Second, this is also coupled with a big tax cut for some of the wealthiest people in America, people that really don't need a tax cut. And these 2 things combined, as hard as it is to imagine, is going to blow the biggest hole in the deficit we've ever had in our country. The biggest deficit we've ever had. So, you know, politics, everybody's always concerned about people, you know, they say one thing, and the other guy say the other thing. Who do you trust? So when it comes to the deficit, I'm going to go to a source that people should trust when it comes to the budget of the United States. His name is Elon Musk. And Elon Musk just said, he's going to be on the Sunday shows, I was disappointed to see this massive spending bill, frankly, which increases the budget deficit, not decreases it. And it's a big, giant hole in the deficit that's happening. So, you know, it's hard to imagine. And what is the big thing that's costing us so much money? It's the tax cuts for the wealthiest people in the country. So I'm all for, you know, trying to make people's lives better. I'm a big advocate for state and local tax deduction, as you know. But we really don't need to cut taxes for the wealthiest people in the country right now, where we're taking away health insurance and food assistance from some of the people who need it the most in our country. So I'm not going to talk much more. I'm going to let all these other folks talk about it. And we'll give you as much detail as possible. But I want to introduce my colleague who's just doing a fantastic job. She's just newly arrived in Congress this year. She's very well respected by her colleagues already. She's doing a great job. And I know she's very concerned about this bill as well. Congresswoman Laura Gillen.
Thank you, Congressman Suozzi, for bringing us all here together. This is a continuation. The Congressman and I did a budget presentation about a month and a half ago to just kind of outline some of the things we saw coming down the pipe with the plan that they had for the bill that they just passed in the House that's now headed over to the Senate. And we expressed our concerns. We had some of the folks who are joining us here today with us at that budget briefing to show that we are being factual. We are not being partisan. We're not fear-mongering. These are the real-life impacts that these cuts are going to have on our neighbors, on our friends, and on our wallets, quite frankly. Because if you think these cuts are just going to hurt poor people, you're wrong. They're going to hurt everybody in our community. The cuts in Medicaid are going to make all of our health care costs skyrocket. We'll hear more from Michael Dowling about the impact on our healthcare system. But I've had people from different health insurance companies in my office talking about how when Medicaid cuts go through, they're going to increase premiums for people with private insurance. So this is going to impact you. The cuts to SNAP. I was with Randy, the CEO of Island Harvest, who's going to be speaking in a little bit, yesterday, talking about the devastating impact. We've already seen food insecurity skyrocket after COVID. People are just starting to really get on their feet again. And the cuts to SNAP are going to be devastating to our community. When we're seeing healthcare costs go up, people are going to stop spending money on food. Parents are going to say, I don't need to eat tonight because I have to pay for my child's prescription. And when they go to places like Island Harvest, they're going to come up short because of the devastating cuts that have been made to the SNAP program and to the Medicaid cuts. And let's be really honest about this. All this is a cost-shifting scheme to make it look like they're making all these really big cuts and they're being fiscally responsible. But as the congressman just said, they're increasing our deficit with these cuts. And what they're doing, for example, with the SNAP program is just trying to shift the burden on New York State to pick up the bill for what the federal government will no longer be sending to New York to try to feed our hungry. And guess what? You know what that means? If New York has to pick up that bill, our taxes are going to go up in one of the most highly taxed areas in the country because we take care of our poor, we take care of our sick, we take care of our elderly in New York. And I think this budget is about what kind of a country do we want to be? Do we want to be the country that cares about the most vulnerable in our society, or do we want to be a country that only cares about those who pay to play? That's the choice that's on the line right now. So if you think it's about eliminating waste, fraud, and abuse, that's wrong. If anybody paid attention to what I did in the town of Hempstead, you know there is no greater champion for eliminating waste, fraud, and abuse in a government system. This is not about that. This is about putting up roadblocks to make our most vulnerable unable to get the assistance they need to get ahead. So I'm glad that Congressman Suozzi brought us here today to talk about these two things, to talk about the real-life impact this is going to have on our community, on our neighbors, on our friends, on our classmates, on the people that we should be caring about. I'm wearing my Southside lacrosse t-shirt today because my daughter is playing in the county championships. We are a community that should care about our neighbors, that should care about our friends. That's the community that I ran to represent. That's the community I want to support. And that's the community I think everybody here wants to be a part of. So thank you.
Okay, so I know this is going to be a lot that you're going to have to try and fit into like a short little package or to a story that you have to do, but there's so much detail for us to talk about here today. I'm going to be introducing folks one by one, but let me just tell you who's here with us. First, we are going to have the CEO of Northwell Health, who's just really an icon here on Long Island, the largest employer, certainly in New York State, and this is going to have an enormous impact on his hospital system that he ably led for so many decades. But let's hear it from Mike Dowling, who's here with us today. Wendy Barwell, who's the president and CEO of Suburban Hospital Alliance of New York State. She's going to be talking about how this affects hospitals overall. So let's thank Wendy for being here today. Dr. Sheetal Shah, who's been coming to my office for I don't know how long to talk about pediatrics. He's the former past president of the American Academy of Pediatrics in the New York chapter, and he's just very knowledgeable about how this is going to affect his patients and the people that he's represented for some years. So Sheetal Shah, let's thank him for being here. Next is another guy that I've known for a very long time who actually called me a couple of weeks ago to talk about the bill, and I said it was really my conversation with him that led us to have this press conference here today. He does a fantastic job as the president and CEO of the Family and Children's Association. Let's hear it for Dr. Jeffrey Reynolds. And really somebody who works here at Yes Community Counseling Center all the time, and a good friend of mine who unfortunately lost his daughter to a tragic overdose, but has really taken his grief and pain with me, and his wife is here as well today, and has given back so much to the community and implemented wraparound services for people to try and help young kids to address issues of drugs, alcohol, and mental health before their little problems become bigger problems. So let's thank Larry Lamandola for being here. And then then Nicole Zarillo, who's here from the AHRC. Now, they call it just AHRC now, right?
AHRC Nassau.
AHRC Nassau, which is really for disabled children, very well respected here on Long Island for such a long time, will very much be affected by these cuts away. Let's hear from Nicole Zarillo. Lady Subin Dresser, who Laura mentioned, was also at our budget briefing that we did when we talked about these problems. She represents one of the largest food banks here on Long Island. Island Harvest does a fantastic job. Again, affects real people and real lives every single day. Let's hear it for Randy Subin Dresser. I didn't really mention it in my initial remarks, but there is in this bill as well big cuts to subsidies that were provided to try and reduce the cost of energy while implementing new technologies to try and help address climate change. These projects are being counted on by people throughout the nation as we speak, and they want to take away those subsidies. The impact of that will be to either kill the project, but also to make people's utility rates go up, because these subsidies from the federal government were designed so that we can make these changes without affecting the local utility taxpayers. A good friend of mine for many years. Let's hear it for Adrian Esposito from the Citizens Campaign. All right, so with that, and listen, I'm blowing it already. We're trying to try and keep this another half hour at the most. But with that, I want to bring really the person that I admire and respect so much, who's done so much to change healthcare in America under very challenging circumstances the entire time, who has not only tremendous ability, but a great heart and great ability and great compassion. And he's dealing with this more than I think understands this better than most people. Let's give a big welcome to the CEO of Northwell Health, Michael Dowling.
Thank you very much, and I want to congratulate Laura and Tom for holding meetings like this. The more we talk about these things, the more people know about these things. And let me make just a generic, broader comment before I talk specifically about this particular bill. It's about philosophy. It's about what we believe, what we care about. And if you take a look at what's happening in Washington right now, in my view, we're taking a giant step backwards. We're going back, as people kind of believe in nostalgia, to a world that they said was terrific 40 years ago. So across the board, what you see happening is an undermining of commitment to public health and health overall. And it's just not in hospitals and in ambulatory locations. It's pretty much in everything. It's a curtailment of commitment to protecting the people against pollution. It's eliminating any commitment whatsoever that we've all been working on for a long time on how to deal with gun violence. It's undermining a major commitment to research and to science across the board. A 50% reduction in the commitment in the funding for the National Institute of Health. In other words, the idea being science is bad. Science doesn't work. Well, we've all today are healthier because of the commitment to science over the last 50 years or so. What you see happening is an undermining of trust in government, in trust in overall organizations. You can't trust this, you can't trust that, you can't believe this unless we say what you believe, what we believe in. That's the only thing you can trust, but anything else is not trustworthy. That's what's happening. You also see an assault on international partnerships and alliances, eliminating our alliance with the World Health Organization, which, by the way, provides us across the board information about what's going on across the world health-wise, allowing us to anticipate what might be happening here. And it's a devaluation of past successes that we've all had. So when you take it all together, it's basically sending a message that We don't care much anymore about health and well-being, people's livelihoods, especially people who are not at the top echelon. And you can't trust anything unless we tell you what we say you should trust. Now you get to the bill that Tom and Laura mentioned. It's a complex bill because the implications of it, I think, are even larger than what we think. Because there's all these rules here and there, and I've been through this many, many times, as you know, I've worked in government for years. But for Northwell, this bill will reduce our revenue by about $370 million. Medicaid bill, the bill particularly that Tom was just talking about, Laura, hits us by the tune of about $200 million. The curtailment of eligibility for Medicaid will hit us to the tune of another $100 million. And about 1.5 million people in New York will not necessarily be eligible for Medicaid anymore. The total impact on New York in general is about $13.5 billion for all of these actions combined. Research will get hit to the tune of about 67 to 70 million. You add it all up, it's about 370 million. So as we go into the budget next year, which we're now in the middle of doing, we have to try to figure out how do we deal with this. But you can't have cuts this size and then all administrative functions, like you have to test eligibility for this, test eligibility for that. Remember something else, this is the bill that the president said, don't cut. You know what he said? We're not cutting Medicaid.
Value and cherish.
Right? So how do you not cut Medicaid and then decide to have all of the implications after as a result of cutting Medicaid? So it's going to dramatically affect eligibility for care. There will be more and more people without help. Organizations will be in dire circumstance. Many hospitals that are safety net hospitals, and at Northwell we take care of everybody, but there are hospitals that are more safe than us, and they will be in terrible shape going forward. So this is, again, going back to what I said at the beginning, this is about what we believe in. We believe in taking care of people and providing supportive services and health services to allow them to exist in a healthy way and in a healthy environment. This is the opposite. We should be going forward, not backward. We should be thinking about what we can do to help people more, not taking away that which so many people have fought for years to get, and just eliminating and then to assume it really doesn't matter. It's your philosophy of government. It's your philosophy about caring. It's what you believe in. We up here believe in something very different. America is better than this. And this is what we got to make sure is curtailed, and we can reverse some of these things as it goes forward, as the bill goes into the Senate. I had a meeting on this earlier this morning with other people about what we should be doing. But this is bad for America. It was a bad impression for other people around the world. I was in Europe over the last couple of days. They talk about this in Europe. This was discussed. What's happening in the United States? This is not what we should be about.
And so, you know, sometimes you say, how can it be this bad? How could they be doing this? I mean, it really doesn't make any sense. What was it that President Trump had said about Medicaid?
We value and cherish.
We value and cherish Medicaid. Don't cut Medicaid, he said. But they're cutting Medicaid dramatically. And so how is this happening? Why is this happening? You have to remember that there was really a decade of effort to try and cut the Affordable Care Act. What this does is actually cuts pieces of the Affordable Care Act. Different eligibility programs that we implemented here in New York and other states. And there's even a Republican senator out in Missouri that's criticizing this incredibly, Josh Hawley from Missouri, because they put into their constitution that they would provide health care for people. And he's saying how this is going back to the bad old days. Okay, with that, I want to bring forward Wendy Darwell, who's going to talk about the effect on all the hospitals in the region. Wendy?
Good morning. So, hard act to follow. I think I drew this short straw, having to go on after Michael Dowling, but I want to build on a couple of points that he made. The numbers here for healthcare are staggering. There's $1 trillion in healthcare cuts overall. It's trillion with a T. The state of New York says about a $13.5 billion cut to the state, and about 1.5 million people losing their health insurance coverage. At bare minimum, we know that's about a $150 million cut a year to hospitals in Nassau and Suffolk counties, but that's before the state has to respond to these cuts. It's not going to be possible for New York State to absorb a $13.5 billion hit without making cut to benefits, to eligibility, or to providers, and probably some combination of all three. So I just want to, those numbers are sort of hard to, bring down into terms of your own family. So I want to just really emphasize this. You may think that these cuts hit somebody else. They hit everybody. We have people who need care. They're going to continue to need health care regardless of whether they have insurance or not. That means they're probably going to come to a hospital emergency room without insurance. They're going to get care in the most expensive way, probably when they are much sicker. So instead of spending a little bit of money on coverage, we spend a lot of money on emergencies, and most of those folks are going to be getting charity care from the hospital. That destabilizes our healthcare infrastructure. Health systems are going to have to respond to that. It's going to be very difficult to retain the level of services and the kind of access that we have now. So if you don't think it applies to you, think about longer wait times at emergency rooms, less access to services in the community, harder to get appointments to see a doctor, because there are going to have to be cuts across the healthcare system. Last point I want to make is, I think a lot of us don't realize just how expansive New York's health insurance coverage options are, and the percentage of our population that are able to get coverage now because of the funding system that we have. It's your neighbors, it's your kids' schoolmates, it's your adult child who just aged off your insurance at age 26. It's your grandparent or parent in a nursing home. In the absence of any better options, Medicaid, frankly, is the long-term care insurance for most New Yorkers. And as Congressman Gillen said, these cuts are also going to have an impact on the commercial insurance market, because those costs are going to have to be offset somewhere. So if you have private insurance coverage, and everybody in your family does, you're not going to be immune from this either. These cuts really cut across our entire community. From the hospital perspective, we did a survey last year statewide and found that the median operating margin of hospitals in New York State was 0.0%. So any cuts push us into the negative. Cuts this staggering just can't be absorbed, and they fundamentally destabilize the infrastructure of our healthcare system.
Thanks. So, who are the people affected? 29%. I'm in a relatively wealthy district compared to other places in the country. 29% of the people of the children in my district are on Medicaid. 2/3 of the senior citizens in nursing homes in America are covered by Medicaid. 1/10 of all the veterans in America are covered by Medicaid. Let's just think about the children and the elderly and the disabled that are going to be impacted by this. This is, we have in New York State one of the lowest rates of uninsured children, one of the lowest rates of uninsured adults in the country. This is going to have a dramatically negative impact on our state and our population in our state specifically. Okay, with that, I'm going to bring up Dr. Sheetal Shah, who's the past president of American Academy of Pediatrics.
So hello, my name is Dr. Sheetal Shah. I'm a former president of the Long Island chapter of the American Academy of Pediatrics, and I'm really here on behalf of the 1,500 pediatricians who practice across Long Island. The recently passed House bill jeopardizes the health of over 8 million children and families nationwide and puts the health of over 37 million children across the country at risk. As a pediatrician, Medicaid is foundational to children's health in our state. Across New York, 49% of all newborns are covered by Medicaid. And 44% of all children in the state rely on Medicaid for access to health care, including life-saving asthma medications and pediatric visits. When you total that up across Long Island, that's over 730,000 families and 200,000 children. Medicaid is for all of us, and I think this is a theme that we're all trying to touch on. It's not just for people who are more socially vulnerable. Even if you get your health insurance through your employer. So I'm a physician in the neonatal intensive care unit, and I've cared for many patients with health insurance plans that have annual spending limits. These are parents who get insurance through their employers, nurses, right, police officers, even physicians. But if you're unlucky enough to have a premature, critically ill neonate, or have a newborn that has a congenital heart lesion, you surpass those limits in a matter of weeks. And very few of us can afford the tens of thousands of dollars a day it costs to keep those children cared for. In those instances, those children can qualify for Medicaid. So for those families, Medicaid is the difference between selling their home to pay medical debt or having continued health care for their premature baby covered. It's a safety net for all of us. And the sad fact is, most of us don't even think about the program that way until we need it. Given the large number of children on Medicaid, our children's hospitals rely on the program to provide high-level pediatric care across Long Island and the state. And you've heard that from Mr. Gillen. But our children's hospitals, particularly on Long Island, are shared resources, and they're specialized facilities. Medicaid payments help keep our world-class pediatric hospitals open, and with such drastic cuts to the program, there's a real threat that our children's hospitals will close. And if they do, we all lose community resources. Things like pediatric emergency rooms, pediatric specialized burn and rehabilitation units, pediatric dialysis centers, and pediatric intensive care units. Finally, make no mistake, these cuts will cost all of us to pay more for health care. The provisions set forth in the House measure will detach children from primary care, which means simple problems that could be addressed in the clinic become bigger problems that have to be addressed in the emergency room. With the expected increase in uncompensated care, hospitals will demand higher payments from private insurers to offset the costs. It's a zero-sum game. And the inevitable result of all of that is higher premiums for all of us. Thank you.
So you think about this, all these terrible sounding cuts, sounds terrible. Why, if they're cutting all this stuff, is the deficit going up? Because they're coupling this with one of the largest tax cuts for some of the wealthiest people in our country, I believe unnecessarily so. And that's causing the deficit to blow up in the process. Okay, with that, I really want to thank Dr. Jeff Reynolds for being here today, because it was really my conversation with him that spurred us to bring this together. So let's welcome the CEO of Family and Children Association, Dr. Jeff Reynolds.
Thank you, Laura, and thank you for your voices in Washington on our behalf. We really appreciate it. So at FCA, we serve about 36,000 people in any given year through 60 different programs, most germane to this conversation. We serve about 400 kids per month in our children's mental health program. We run 2 state-certified treatment centers, one in Hicksville, one in Hempstead, and then we run 3 recovery centers from Westbury to Riverhead that serve folks that have struggled with addiction. It's no secret that this country, that this state, and that our island has struggled under the weight of a mental health crisis since COVID ended. Mental health issues didn't start during COVID, but they certainly got worse, as did the numbers of overdoses that we started to see. And over time, we know that more than 1 in 4 adults has demonstrated symptoms of anxiety and depression. We know that when it comes to kids, it's closer to 1 in 3. And we know that all the data we look at now says that about 1 in 6 kids has contemplated suicide. The single largest payer for children's mental health care is Medicaid. Why? Because those kids face a different level of pressures than other kids do. It's also the single largest payer for addiction treatment in this state and other states. At FCA, we've seen a steady increase, although things are starting to get better in attempted suicides, in completed suicides, in involuntary placements and hospitalizations of kids, of families that have really been struggling under the weight of discord, school avoidance, you name it, the list goes on and on. In fact, the American Academy of Pediatrics declared a public health emergency when it came to children just last year. So it's undeniable. Yet, one of the ways that we've made any progress whatsoever has been through Medicaid programs that support children's mental health programs. It supports the facilities that are ready, willing, and able to prevent these kids from taking their own lives. It supports the families that are struggling under the weight of going to sleep every night knowing that your child is struggling and wondering whether they're going to be alive when you all wake up in the morning. The Secretary of Health and Human Services recently did a victory lap on the drop in opioid overdoses. Certainly a 28% decrease in fatalities is cause to celebrate, but not for too long, right? That reduction in deaths meant that 30,000 Americans didn't die. They'll now be able to spend summers with their families. But 80,000 Americans did. That's nothing to celebrate. And when we look at where we made the gains, we actually saw increases among young people who are under the age of 24. Why? They don't have good access to care. We actually saw increases in fatal overdoses among communities of color. And so the progress has not been equal in any way, shape, or form. Medicaid is paying for the bulk of treatment for folks that are struggling. They're also the primary payer for what's called medication-assisted treatment, which is the gold standard in preventing overdoses. So as we began to turn the corner on the mental health crisis, and families began to return to normal, as we began to see a drop in overdose fatalities that we hope one day will hit zero because overdoses are preventable, now is not the time to rip the rug out from under those families. Now is not the time to rip the rug out from under hospitals, from communities, from folks that have spent 10 years just looking for a glimmer of hope in the midst of crisis. We finally have that glimmer of hope, only for some folks in Washington to want to take it away. I'm happy that we're up here with folks that are not going to let that happen on their watch. Certainly, everyday average folks out there that are watching this happen should understand this can happen to anyone's family. You want to make sure that care and treatment and support is available. It's time to speak up now. Thank you.
This has such a ripple effect. You know, when you don't have health insurance, you go to the hospital, you still get treated anyway. That's the New York State Constitution. You have to give everybody health care. It costs a lot more to treat people in the emergency room than it does in the clinic, as was mentioned earlier, when they have health insurance. Drug, alcohol, and mental health. 75% of the people in jail have a drug, alcohol, or mental health problem. We're finally waking up to that reality. We're trying to address drugs, alcohol, and mental health problems, especially for young people, before those smaller problems become bigger problems. And we talk about suicide, but there's so much even before suicide or accidental death. There's kids going to jail or adults going to jail because they have a drug, alcohol, or mental health problem. And that's a tremendous cost on society. Think of the crime to come through. All these things have such a huge ripple effect, and we're making such tremendous progress. And there have been people for years trying to, again, rip out the Affordable Care Act, rip out these progress we've been making, and this budget does it. And we were hardly even paying attention because there were so many other things going on at the same time that people aren't even aware of how dramatic it is. That's why it's so important that we have leaders like this that are trusted, not just the politicians, the leaders that are up here that are telling us how this is going to affect us in real life, in our homes, in our families here on Long Island. Someone who's been affected by the scourge of drugs and alcohol and mental health is someone who's become a good friend of mine. He's really done so much good work. Let's welcome Larry Lemondola, the co-chair of the Levittown Community Action.
Thank you, Tom Suozzi. Thank you, Laura Gillen. Good morning. I want to pivot for a moment, talk about something else for just a brief moment. Yesterday, I was at Patrick Ryder's Community Council meeting, and I met up with Tom McEvitt. Tom McEvitt is on the steering committee with me of the Levittown Community Action I've been bothering Tom about this for quite some time. There's $100 million sitting on the sidelines doing nothing. Finally came up to me last night and says, "Oh, the portal is open." The only thing I know about a portal is a portal in a ship. And so I asked him, so what's going on? Is this gone out to the public? I immediately went online, I looked this up. I found maybe one story about it. So all of you here today in media have to ask the tough questions. Where is that money going to go to? And it's got to go to facilities like YES, like FCA, like LICAD. This is important. The county has to, you have to hold their feet to the fire.
So he's talking about $100 million from the opioid settlements that's in the Nassau County.
The Sackler family has blood on their hands. They should have gone to jail. Okay. I'm here on behalf of the Levittown Community Action Coalition, and I'm going to speak on behalf of YES today. The Levittown Community Action Coalition is an invaluable resource. The coalition has only one paid associate who is a trained social worker. It's a liaison to the community, to the Levittown School District, and Island Tree School District. It provides that external community support. We too could lose our funding, and we're not funded by Medicaid. I want to speak a bit about the YES Community Counseling Center. Let's say our coalition coordinator who deals with the Levittown youth with programs from time to time is dealing with a specific student that has some mental health issues and or some substance issues. They would most likely refer right here to the YES Community Counseling Center. There is the what if. The what if they have no health insurance. There's Medicaid. Medicaid goes away. That's not good for these students in need. I lost my daughter to fentanyl in 2019. In 2017, my wife Eileen and I were faced with the reality that Lisa, she was then 23 years old, with substance use disorder, would lose her health insurance by the age of 26. Eileen was still teaching here when Lisa was 23 in the Levittown School District. We were fully prepared to apply for Medicaid at that time. Sadly, our daughter died of fentanyl poisoning at the age of 25. I found her in her room on September 19, 2019. Imagine a parent today trying to get their child on Medicaid today with that same story, under the same circumstances. Frankly, the fear would overwhelm me. It still overwhelms me. Are we that caring, compassionate, charitable country on a path to continue with the safety net of Medicaid for those who can't afford health coverage? Or are we that callous, cruel, cold-blooded country on a path to take health coverage away from those in need in lieu of making some rich folk maintain their tax cuts in the richest country in the world? Why? I wrote into my little script here something to ponder. There's nothing to ponder here. The choice is obvious. This administration has ice water running through their veins. Period. Thank you very much.
Okay, now Nicole Zarillo from AHRC. How many years has AHRC been around?
More than 75 years.
75 years. Let's give
But
Nicole.
she hasn't been there.
Come on, Nicole Zarillo.
Thank you.
AHRC.
Congressman Suozzi and Congresswoman Gillen, thank you for the opportunity to speak today about how the House Budget Reconciliation Bill would impact Long Islanders with intellectual and developmental disabilities, also known as IDD. This bill's proposed Medicaid cuts, along with new administrative hurdles, would directly impact more than 7,000 people with IDD in Nassau County, nearly 9,000 in Suffolk, in addition to their families and the workforce that supports them. Medicaid is the backbone of disability services, funding housing, employment services, transportation, day services, and the direct support professionals who assist them with everything from meals to medication. In New York, Medicaid funds approximately 95% of services overseen by the Office for People with Developmental Disabilities, services delivered by agencies like AHRC Nassau. Cuts at the federal level would be devastating. Medicaid is a shared federal-state program, and when the federal share shrinks, states must choose: reduce services, lower already inadequate provider rates, or force people onto waiting lists. We've seen it before. From 2010 to 2012, every state made cuts to home and community-based services in response to reduced Medicaid funding. Today, that would mean more staff leaving the field, smaller providers closing, and people with developmental disabilities losing the supports they depend on to live safely in the community. New York recently infused $850 million into our field, and we're grateful for that progress. The continued investment relies on a stable federal match. We cannot afford to backslide. We also cannot afford more red tape. Forcing those with a lifelong developmental disability to recertify Medicaid eligibility twice a year won't improve accuracy or root out fraud. Proposals like this simply limit coverage. This bill threatens to unravel over 75 years of progress. For decades, we've moved forward away from institutions and isolation towards inclusion and opportunity. Thanks to the steadfast support of families, advocates, providers, and policymakers. The bill risks cutting these critical supports, weakening services, and pushing people back to the margins. We urge you, protect Medicaid, protect the right to live in the community, and protect the future we've spent generations building. Thank you, Congressman Suozzi and Congresswoman Gillen, for your leadership and for giving voice to those who too often are left unheard.
Talk about previous cuts from 2010 to 2012. And remember, that was in response to the financial crisis the country had faced in 2008 and 2009. So now we have this massive cuts that we're facing to pay for tax cuts. That doesn't seem to make sense. I mean, it's not like the economy's in trouble in America right now. Back then, we were facing one of the biggest financial crises we ever faced in the history of our country. And these cuts were made in 2010 to 2012. I think it was under the Obama administration that would have been. But it was in response to the financial crisis.
In 2008.
Yeah. So it really doesn't make sense. Okay. Now we have two more speakers, and then we'll take questions. I want to bring up Randy Shubin-Dresser, who represents the CEO of Island Harvest, who really will talk about the food insecurity here on Long Island and how these cuts will affect people on Long Island. Randy?
So my question is, why are the most vulnerable in our communities seemingly always the easy targets? Why is it that the people that need our care the most are the ones that are always concerned that they're going to lose that care that they so desperately need? Here in New York State, 2.8 million New York residents are recipients of SNAP. 14% of our population, that's a tremendous amount of people in our community that depend on SNAP dollars. And SNAP dollars are not just about giving people who are vulnerable funds so that they could buy food in a supermarket. It's actually an economic generator. Because when 2.8 million residents are receiving funding, they're taking those funds and spending them in our supermarkets and our bodegas and our delis to buy food for their families. And so it generates $11.5 billion in New York State. That's important as well because it helps our local businesses. And so there are many benefits. What we need to think about is the cause and effect of some of these cuts and recommendations. They undermine the trust of the nonprofit sector, who are desperately trying to help our most vulnerable neighbors. When we talk about cuts in SNAP that's recommended in this House bill, it will take an average of 9.5 billion meals off the table every year across our country. I'm going to repeat that because every meal supports a person. Every meal supports a child, our grandchildren, our grandparents, our veterans. And so 9.5 billion meals are at risk for our neighbors, our relatives who are most in need. These federal funding cuts have already impacted organizations like Island Harvest. We've gotten word of a reduction of $1.7 million, which already has taken 1 million meals off the table for Island Harvest to distribute to our community. We can't afford that. And Island Harvest is not in a position to make up for the loss. We've been through many disasters over the 24 years that I've been at Island Harvest. We've gotten ourselves through the pandemic, Superstorm Sandy, recessions, government shutdowns. And in all of those times, we've been able to turn to our contributors, our investors in our mission to help us through some of the tough times. We've reached out to those funders, and they've told us they're not sure if they can help us now because they're not sure about the stability of their investments in their own funds. And so they don't know if they can make additional gifts to organizations like Island Harvest so we could put food on the table for grandparents, for children, and for veterans and families who desperately need it. Many Long Islanders already don't qualify for benefits because the cost of living is so high here on Long Island. And so why is it that in the richest community, with some of the richest zip codes in the country, Island Harvest is helping over 200,000 people each year. 200,000 people that turn to the food bank each year. And we are one ecosystem. And so if there are cuts in other industries, in housing, in mental health, in Medicaid, whatever it may be, it always means that people have to make decisions about where to cut in their own family budget. And the easiest thing that people can cut is their food budget. It's fungible. We eat 3 meals a day. And so countless parents are giving up 1 and 2 meals so that they could feed their children, pay their medical bills, and pay for transportation to get them to the doctor. If more of these cuts happen, they're going to have to cut more of their meals at home. How is it that we are allowing young mothers to water down formula that they're giving to their babies, their infants, so that they can make it through the day, which makes them unhealthy? Why are we allowing this to happen? We need to stand together. We need to support our community members. I'm going to use a phrase that was used before that I think we can all embrace. America, we're better than this. We're better than this. We need to help our most vulnerable neighbors because they're the ones that really help us in our communities and keep it sustainable. I thank you, both of you, for your leadership and your support. And we stand with you with whatever we can do. Our mandate is to end hunger here on Long Island. We're committed to doing that however we can possibly do it.
Thank you. Again, for food stamps for SNAP, let's remember that out of 100 people that get food stamps or SNAP assistance, 30 are children, 21 are senior citizens, and 10% are disabled. So that's 61% of every 100 are children, elderly, and disabled. So this is really just, responses to this will be, oh, we're just putting in work requirements. We're just trying to make things more efficient. We're trying to, get rid of waste, fraud, and abuse. That is not what this is about. And these experts will tell you that. This is what they deal with every single day of their lives. They've committed their lives to addressing the problems that people face in these communities. And that's why we have them speaking more than us speaking. Okay, next and finally, the Executive Director of the Citizens Campaign for the Environment. There are cuts being made that are going to affect your utility bill and are going to affect your quality of life. Let's hear it from Adrian Esposito.
As the cleanup batter, I'm going to take this in a slightly different direction. Look, there were a lot of great things about the 1960s. The music, the Beatles, tie-dye clothing, maybe bell-bottoms. But the energy policy wasn't one of them. And yet, this big, ugly bill takes us back to the 1960s energy policy. Today, we are implementing a 21st century energy policy for the 21st century. Tomorrow, we'll be taken back to the 1960s. What this means is that what this bill does is it completely derails the clean energy sector. And make no doubt about it, the clean energy sector is one of the fastest growing job creators in America right now. Since the Inflation Reduction Act occurred, there have been over 2,000 new industry and manufacturing companies started up in America, generating $289 billion in private sector investment. What is that rendered? Jobs. Jobs in America. 500,000 jobs. Here in New York State, it's generated 29,135 jobs in the clean energy sector. You know who has those jobs? Working and middle income people. That's who have those jobs. This bill completely eliminates the tax credit for solar energy and residential and commercial solar. You know who's using the tax credits for residential and commercial solar energy? Low income and working class Americans and New Yorkers. That's who's doing it. Why? Well, I'd like to tell you it's because they want to save the planet, but no, that's not why. They're doing it because of the affordability and the stability it adds to their home energy bills, because we're all working to stretch a dollar. The bill also eliminates all the tax credits for electric vehicles. You know who's using the electric vehicle tax credit? Working class and middle income residents. Why? Is it to save the planet? No. I'm sorry, it's not. But it is, in fact, to add affordability to their transportation, because they don't have to pay for gas, because gasoline is unpredictable and expensive. The bill also does away with all the tax credits for energy efficiency, like appliances, putting in a new HVAC system, changing out your windows. You know who's using those tax credits? Working class and middle class income people. Those tax credits made our homes warmer in the winter, cooler in the summer, and generally helped us stretch our dollars and save energy. What this bill also does, because it's all about drill baby drill, and we're going back to using oil and natural gas, is that will add to the pollution burden of our nation. It will increase air pollution, which means it will increase asthma rates, heart attacks, respiratory illness, and premature deaths. It'll increase water contamination, and it certainly will increase and accelerate the impacts of climate change, which to Long Island is something we deeply care about. So overall, taking us back to an energy policy of the 60s is bad for our health, it's bad for our local economy, and it's bad for America's energy independence. It makes no sense unless you've invested in the oil industry. Thank you.
Okay, so we're going to open it up for questions, and Laura's got to go in a few minutes. Mike Downey had to go already, but we'll take any questions you have.
I'll ask a question because as you outlined...
Who are you, miss?
I'm Karen Rubin with as you outlined this, it seems so obvious. It seems so obvious. So I'm going to ask you a question. If the underlying purpose of this isn't to save lives, increase productivity, make lives more affordable and low quality, I'm going to ask you if my thinking about it might be correct. They want the poor to die. They want the elderly to die because they're the burden on spending, and they want people not to advance to their full potential. Comment on that, please.
I hope that that's not true, and I don't want to believe that that's true. But I do believe that the intention is for them to provide a tax cut for some of the wealthiest Americans. And this is one of the ways they think that they're paying for it, but they're really not paying for it because they're increasing the budget deficit, the biggest it's going to be in the history of the country. Okay, any other questions?
If this fails in the Senate, would they revise it to start it all over again with a different bill?
If it fails in the Senate, I want to make it clear that I stand, and I'm sure Laura stands, ready to try and work on a bipartisan compromise where we can address some of the good things that are in this bill, like the state and local tax deduction, like tax cuts for middle-income families, and other things like that. You know, a lot of the tax cuts are things I would support, but let's raise the top rate for people who make over $660,000 a year back to 39.6 where it was, instead of being at 37. For people that make $400,000 a year or $500,000 for a married couple, raise it from 35 back to 39.6, which it was under the Clinton administration, under the Obama administration, when our economy was booming. Let's not give the extra tax cuts that they're giving to businesses that what they call the pass-through deduction, which I don't know why they had to increase it from 20% to 23%. It doesn't make any sense to me. So that would bring almost $1.5 trillion back, which would reduce the deficit and also provide money to save these programs that are so essential to us. So there could be a bipartisan compromise on a lot of stuff, but it just even Trump was saying at one point, let's raise taxes on people who make over $2.5 million a year. That was rejected. When we were in Ways and Means, we said, let's raise taxes for people we offered amendments. For people who make over $400,000 or $500,000 for a married couple. They said no. We said, well, okay, let's raise taxes for people who make over $1 million a year. They said no. We said, okay, let's raise taxes for people who make over $10 million a year. They said no. We did another amendment. We said, let's raise taxes for people who make over $100 million a year. They said no.
I think
So,
that's an important point. We put forward over 500 amendments to this bill to try to make it better, to try to help our constituents, and every single one of them was rejected. That's why they had the Rules Committee hearing at 1 a.m. and people weren't tuning in, they weren't listening, and they didn't think we would show up. But I will tell you that our caucus did show up. I was ready to testify at 3:30 a.m. I testified at 3:30 p.m. because there was so much debate and there were so many amendments and so many people were passionate about, including the congressman, about talking about their amendments, about working together to make a better bill. And our efforts were flatly rejected in a hyper-partisan fashion.
So in the Ways and Means Committee, we convened, this is now about 2 weeks ago, at 2 o'clock in the afternoon. We went straight through the night until 10 o'clock the next morning, or maybe it was 8 o'clock the next morning. Okay, people were literally falling asleep during the hearing, and were offering these amendments because they rejected them. After this process takes place in all the committees, it then goes to the Budget Committee. The Budget Committee purposely convened Sunday night at 10 o'clock at night. Sunday night at 10. It had been defeated the earlier week before. They brought back to Washington Sunday night at 10 o'clock. Then the Rules Committee scheduled after that was at 1 a.m. in the morning on Tuesday, last Tuesday. 1 a.m. in the morning. And it went on all day long. And then then it goes to the floor. It has to go through the rules debate. It's got to go through the debate on the actual bill itself, and then let me make clear, they put in a bunch of changes in the middle of the night as well. I mean, there's hundreds of pages of bill, 400 pages of changes in the middle of the night. And then we voted on it at 8 o'clock the next morning. So we were up all night. We read in the paper how some people missed the vote because they fell asleep. And people were exhausted. It was all because they didn't want you to cover it. They wanted you to talk about the plane from Qatar. They wanted you to talk about the tariffs. They wanted you to talk about everything. They don't want you to talk about they're cutting taxes for the wealthiest people in the country, and they're cutting Medicaid for some of the most vulnerable people in the country. Okay, yes, Miss, you wanted to say something?
Hi, Ethel Hall with Newsday. Could you summarize once more, I think when you spoke a little to this, how some of the cost burdens will be shifted onto New York State? Just once again, explain how that works and what the implications will be.
When do you want to take a crack at that?
I can take that, sure. So there are many categories in this bill that reduce funding that goes to states. So almost categorically, every way that New York State is able to draw down additional federal dollars to match their own Medicaid spending, there are cuts to those initiatives. That's on top of and aside from the specific cuts to eligibility for Medicaid. So that's billions of dollars that the state is going to lose, which New York uses to support its healthcare system. For example, we have about a third of hospitals in the state of New York are considered financially distressed. The state provides supplemental support to those hospitals to keep them open. Those federal matching dollars help the state to be able to do that. So when you go through that bill, sort of, row by row, there's just one hit to New York State after the other, and that ultimately jeopardizes the ability to keep healthcare facilities open. Many times in our most vulnerable communities, but it impacts every community because you're still going to have people who don't have insurance who are coming for care, and that's a burden on the whole system. So that's why it's really undermining this whole infrastructure.
And Bahar, we can get you more specific details if you want to get them. I mean, for example, New York State's constitution requires, pursuant to a court case, that we take care of everybody gets health care. And we have people that are legal residents, that are not citizens yet, legal residents that are here in the country that are eligible for different health care programs, that under this bill, the federal government will not pay their matching share. So we still have to provide, pursuant to our New York State Constitution, the health care for these folks, but the federal government's not going to pay their 50% match.
And actually, they're going to penalize the
They're
state
gonna penalize-
exactly.
for spending its own money
right.
to cover that population.
And then there's all kinds of little things. It's really it's highly detailed, complex stuff that, we're finding new things. Someone was talking about, Mike Dowling was talking about guns. I was like, boy, there's a provision in the bill. This is crazy. And I think we should wrap it up. I'll probably leave my next thing. So there's a provision in the bill. In 1934, the federal government passed a law in response to like gangsters, things like Dillinger and Capone, things like that, that said you have to pay $200 if you have an unusual or dangerous accessory to your firearm, silencers.
Yeah.
Okay, and it's typically used as in quotes used by gangsters. And there was a $200 fee, and you had to register your silencer. In 2024, last year, the U.S. government brought in $145 million from the 710,000 silencers that were sold in the United States of America. But they all had to be registered. You remember that guy Luigi Mangione that tried to get a silencer on his gun? Because it's used by criminals very often, because you don't want to be detected when you actually commit your crime. You don't want people to hear the shot. So in this bill, $200 fee started in 1934, never increased, which today would be $4,800 if it was in today's dollars. But it stayed $200 since 1934. In this bill, they removed the $200 fee, and they removed the requirement that you have to register your silencer. Now why would that be in this bill under the cover of night? And there's lots of little things like that in this bill that are all kind of like, where did this come from? And all the things they wanted to do for years, like cut the Affordable Care Act, make it easier to buy a silencer, for example, they're all put into this bill. Okay. Anybody else? All right. Thanks very much, everybody. Sorry we went so long.